It's been a lot of tears during COVID because you lost loved ones. We lost people that we cared for. We've seen families who are not able to say bye to their families as they pass away during COVID. But throughout this time filled with tears and angst and anxiety, lots of anxiety, there's been happiness. Sometimes we have to go through these trials and tribulations to realize what we have. And I was blessed enough to have that. And blessed enough to be around people who accept their happiness and their anxiety because we need both in order to make sense of what's happened in the last year.
So I've been a nurse here at the Washington Hospital Center for 30 years, and I can say I've seen a lot of challenges and changes, but nothing compares to the coronavirus, COVID-19 pandemic.
The news was daunting. It was scary. No one had an idea at first of how this was going to go.
Our first patient hit the ICU. Sunday, our second patient hit the ICU. The following, I don't even remember now, the following Tuesday or Wednesday, back to back to back. It was, I've got a COVID, I've got a COVID, I've got a COVID. And I think we admitted 10 patients sequentially in that one day, all COVID.
COVID started, going into the room, trying to figure out the donning and doffing, just trying to keep everything clean and not really knowing what we were to do at the beginning. It was scary.
Yeah, lots of scrubs, lots of showers. At the beginning, we were changing scrubs after every intubation, showering after every intubation. There's times that I was in the shower and we get another call for another COVID intubation.
In respiratory, we had increase in the number of patients. And the hospital opened a special ICU for COVID patients. And that means if you walk on that floor, all your patients are going to be COVID.
Because there have been a few intubations that I've gone to that I've been kind of the last person, and they know that now, and we know that now, and this may be it. Yeah. It's definitely gotten to be a lot more humbling and a lot more of, okay, if they need 20 minutes to talk to their family, by all means, we are going to wait.
When the pandemic first began, we did separate them. It was a really sad scene because we had to keep baby away from mom 6 feet. And so it was like you waited 9 months to see this little precious gift, and you can't touch the baby, you can't breathe on the baby, you can't do anything. And it was really, really sad.
The first thing that I noticed that changed when when our numbers started going up was actually on the stroke side. We started to see young, healthy people with no comorbidities coming in having large vessel occlusion strokes. And then when we would test them, we started to find that they were all COVID positive.
Being essential personnel, you had to still come to work and go home, and it was day after day, just like a normal day.
So before the pandemic, my job involved getting out a lot. I was in people's homes, I met with them in restaurants, coffee shops, things like that. My life was all about getting to know people in the community and building relationships with them.
Where we work with the telehealth now, we do the e-visits, so we don't get as much engagement with the patients like we used to on a one-on-one basis. The doctors see them more on, with the televisits.
So we were able to see some patients. Now with ophthalmology, there's some things that you can't do virtually, but you can do maintenance where if a person is diabetic or if they have glaucoma or if they have something in their eye, the doctors can monitor that and provide care.
So at the beginning, it seemed like every week there was new changes. Like we started wearing the masks, and then it was, 5 people can only gather, and then it became, we have to distance within our offices. So I think just rather than getting frustrated that these things continue to evolve and everything is so uncertain, I'm always reminded that one thing you can control is just your mindset and your attitude.
Let me tell you, it's sometimes hard not to take it home, because all you would think is, did I do everything I possibly could before I left? And did I do everything I possibly can, or catch whatever I can catch before I left?
We're more conscious about our interaction with patients. I think we're even more aware in terms of our relationships with our patients and being more sensitive to them, because COVID kind of puts you on a different kind of level of awareness in terms of life and appreciating life and appreciating the relationships that we form, even if it's just for a few minutes.
I remember one day I went into a room and I saw the patient, and the patient looked at me and said, "Am I gonna die?" And that was a question that I don't know what to say, because I don't know her condition, I don't know what was going on. But still I give her courage and hope. And I said, "Guess what? Are you dying now?" She said, "No." I said, "That's right. You're living. Aren't you breathing? Yeah, you're fine. So don't worry about today. Today, you're alive and you're well. So just enjoy today." And then, that put a little smile on her face, And I don't know how much it helped, but at the moment, she started smiling and knowing that today is given to us. Tomorrow is another day. So we make the best of today because we're here today and we're alive.